As we were discussing insulin and insulin analogs, so in this lecture we will discuss the different insulin analogs and what will be the different route of administrations and the peak level of the insulin one can get after the administration of the insulin. So all these things we will discuss in this lecture. So we have categorized insulin into two. First is the rapid acting and second is the short acting. So in the short acting insulin, you will see the regular insulin that is commonly available in the pharmacy. And second is the rapid acting insulin. These are basically the analogs. How can you get analogs from the insulin? Because we know that the insulin is a polypeptide. After some changes in the insulin, in the regular insulin, you can get the insulin analogs. Just change the amino acid sequence, it will become the insulin analogs. So you have different insulin analogs that will fall in the rapid acting analogs. First is the insulin lispro, second is the insulin aspart, third is the insulin glulicine, and fourth one is the inhaled insulin. So these are the common insulin analogs that forms from the regular insulin by just making a different modification in the amino acid sequence. Okay, so regular insulin available in the market in different brand name like Humulin R and Novolin R. These are the two brand name, and the common name will be the regular insulin. That is an important thing. In the market, you will see these names, not the regular insulin. Insulin Lispro is it basically a generic name, and in the market, it will be available with the name of Humalog. Okay, insulin aspart in the market it will be available with the name Novolog. Insulin glulicine it will be available in the market with the name of the Apedra. And inhaled insulin it will be available Afrezza. Afrezza will be a name that is available in the market. So these are the different analogs of the insulin. So after administrations like the subcutaneous administration, and you will see the different peak level at different time. So if we discuss this axis, here is the x-axis, here is the y-axis. On the x-axis we have taken time in the hour. Here is the 0 hour, 1 1 2 3 4 5 6 7 8 9 10 11 and 12. These are available in the hours. And on the y-axis we have taken plasma insulin level. After administration, how much time will it take to reach at the peak level? So we have two categories, rapid acting and short acting. So in the uh, rapid acting, you will see the inhaled insulin, these special form of the insulin that patient has to inhale. Second is the insulin aspart, insulin lispro, and insulin glulicine. So these are the four rapid acting insulin analogs. Okay, why do we call it rapid acting? Because it will achieve peak level in short interval of time. For example, if I say after administration any of these insulin analogs, it will reach at the peak level within 30 to 90 minutes. It will take approximately around about 1 hour to peak at maximum level, minimum 30 minutes and maximum 90 minutes. So here is the peak level. So it will achieve peak level in short instant. That's why we called it rapid acting insulin analogs. Okay, we have regular insulin. it will works in opposite direction. It will take more time to reach at maximum level. So in that case, regular insulin will take 50 to 120 minutes to reach at the maximum level. So again, approximately it will take 2 hours to reach at the maximum level. Here is the maximum level of the regular insulin, and here is the maximum level of the rapid. So but after that, with the passage of the time, the insulin that has been administered in the body of the patient will, with the passage of the time, it start decreasing, and ultimately a time reach when the administered insulin will diminish inside the body of the patient. So that is an important thing. So what we have learned today, rapid acting and short acting. Rapid acting because it will reach at maximum level in short interval, while it will as compared to the other insulin analogs, it will start decreasing earlier as compared to the other insulin analogs that we will discuss in upcoming lectures. Okay, again, you have to, in case of regular insulin, when someone wants to administer regular insulin, so patient will administer 30 minutes before taking any meal. So that is another important thing. But in case of rapid acting, you will see 15 minutes before meal. Why there is a difference of 15 minutes in that case? Because it's a slow, it will take some more time to reach at the maximum level as compared to the rapid acting. That's why 15 minutes is enough for the meal in case of rapid acting. And patient can also take after the meal, but the time should not be longer than 15 to 20 minutes. Again, that is an important thing in case of rapid acting. So that's the difference between the rapid acting and the short acting insulin analogs. So postprandial glucose level, after taking meal, blood level, blood sugar level start increasing. So in normal situation, your body will produce the insulin through the beta cells of the pancreas, and after that, after some time, it will start decreasing the level of the glucose to the normal level. That is, body will produce the endogenous insulin. That will happen in normal situation. After taking meal, glucose level start rising, but endogenous insulin will produce, and it will decrease the level of the glucose to the normal value. Okay, but when insulin is not producing inside the body of the patient, then what will be the other options? You have to decrease the level of the glucose in the blood of the patient. So we have to take, or the patient has to take exogenous, outside insulin will be available, that we have discussed in this lecture. So exogenous insulin or insulin analogs will be available, that patient has to take after the, before the meal, because it will take some time to compensate the level of the glucose that is rising after the prandial, after the meal. So that is an important thing regarding this postprandial glucose level. So this is all about the insulin and the insulin analog. If you still have any question, you may ask in the comment section. Thank you so much.